I'm an emergency physician, and first of all, I love your book. I have a lot of anxiety myself, so I kind of read your book knowing that this was going to be really interesting for myself and my own process. And just kind of like how I'm approaching this fellowship, I'm like, how is this going to apply in the emergency department? Because it's such a different setting. Although I do find that we have a lot of patients that come in that, we call them the worried well.
Mm-hmm.
And, we have the obviously sick patients that, we're doing stuff to save their lives. And then we have a lot of, frequent flyers or other patients that come in that are just seem well. And so you're trying to look for the medical issue. And a lot of times you can't find one. And I've never really approached it with this kind of curiosity with patients that I found myself doing more with this module in general that we're working on. And then also after reading your book. And I've had a lot of really good interactions in the moments that I've actually been able to sit with some patients that come in with these kind of vague complaints and just kind of explore like what that means to them and what they're worried about. And really when you get to it, sometimes they're really not worried about their presenting complaints, like their chest pain or their palpitations. And it's when you actually take that time to actually ask them, like, well, what are you worried about, and be curious about it. I found that's been really interesting. And now I kind of have this different insight into how this really can apply even in the ER, So I've really enjoyed. So I don't really have a question, but I just kind of came to say that I didn't anticipate that. And so I've been pleasantly surprised by that. And
well, it's really great to hear. And, if I could have only one capacity, or if I even had to distill all of the Buddhist teachings down to one word, I would say curiosity. If you look at Dhammavicaya, the second factor of awakening, it can be translated as curiosity, investigation. And if you look at that, bring awareness and curiosity together, you rub those two sticks together, and then suddenly all the other factors of awakening emerge out of conditions, cause and effect. And so it's like in the emergency room, I haven't been in the emergency room since residency, but it's like, what better superpower to bring with us so that we don't jump to conclusions, so that we don't, all these things that apply in the emergency room and beyond, it's like, and then that becomes contagious, where the person that we're with is curious with us. And then that creates the container, the safe space, the place for them to be like, what am I worried about? As compared to when, we can't think when we're in fixed mindset, we can't explore. But when you come in and you are like spreading curiosity, I wonder what the R naught of curiosity is. It's like when we're really sneezing curiosity, so to speak, it's like, it's really contagious. And it's so helpful in that way. So thank you for bringing that forward. And it's so nice to hear you being curious and exploring how you can bring it forward in the emergency department. So thank you.